Alrighty, good afternoon, everyone, and thank you for having me. My name is Amanda Melstein. I'm a primary care pediatrician at Children's Hospital Oakland and a co-founder of an organization called Climate Health Now, whose mission is to organize and mobilize the health community in California around climate advocacy. It is an honor to be speaking with you this afternoon. My hope, especially in these uncertain and turbulent times, is that you leave this talk feeling a little more inspired and a little more empowered to act in some way in the face of climate change, which poses a threat to the health of newborns and pregnant people around the globe and here in California. I have nothing to disclose today. Here is our outline. I'm going to start by sharing why it is I do this work and what got me here in front of you all today. We're going to talk about why climate change is a health crisis for pregnant people and neonates especially. We're going to talk a lot about why our voices as health professionals matter in climate advocacy and specifically climate health advocacy. And we'll end by talking about different ways to engage. These are our learning objectives. I'll let you all read through those rather than me reading them for you. Alrighty. So before we even jump into the nitty-gritty of what's going on with our climate and how it impacts pregnant people and neonates, I'm going to just start by sharing a little bit about myself and how and why I'm here talking to you all today. I have not always been passionate about climate change. I've come to think of my life as sort of before and after 2017. Um, Prior to 2017, I was certainly intellectually aware of climate change as a problem, but I really thought of it as a problem that other people were solving that was really outside of my lane as a pediatrician. In October of 2017, on a dry and windy night, my world changed forever when my parents, who had newly relocated to the Napa area in Northern California from the East Coast, were evacuated from their house twice in the span of 4 days. In the picture on the far left of the screen, you can see there's a picture of my son, who at the time that photo was taken was about 15 months old. And I have it here because it was taken by my mom around 6:30 in the morning of their first evacuation, when they came to our house in the middle of the night. I was also actually newly pregnant at that time, feeling just a great deal of vulnerability about motherhood and taking care of young children. That night and that week, my parents' house didn't burn, but a fear and uncertainty, and then ultimately a resolve, really took hold inside of me. Fast forward a bit, for those of us who are in California and especially in the Bay Area, but really throughout this state, 2017 was really a turning point where we now in the Bay Area especially have fire season and smoke season. For those of you who were here during that time, you probably remember weeks and weeks of unbreathable air, inability to go outside. In September of 2020, we experienced an entire day of darkness because the smoke was so thick for the sun. The sun was unable to penetrate. In 2019, I began working as a primary care doctor in Richmond, California, which is a refinery city. From my office window on a clear day, I could see the smokestacks protruding from the Chevron refinery. And within a few weeks of starting my position there, I started to notice some really different patterns among the patients and families I was interacting with. I had, first of all, just a much larger percentage of patients with asthma than I was used to seeing, having practice in other parts of the Bay Area. I also started to meet families of newborn babies whose very first question to me, or very early on in our first visit, was, "Doctor, does my baby have asthma?" Which, initially my instinct was to answer with sort of my doctorly hat of asthma is not something you're born with, it's something that develops over time. And I really came to understand that actually for people in Richmond, many of whom have had families there for many, many generations, that asthma is a given, not an if. The rate of asthma in Richmond is about twice the national average. And Richmond really is, especially some parts of it, what a lot of folks call an environmental sacrifice zone. Ended up in, so talking about Richmond, which is an environmental sacrifice zone. And I really at this time started to piece together a lot of different things, that the processes that are causing climate change and causing the world to warm, primarily the combustion of fossil fuels, was also actually what was making my patients in Richmond sick. They were sick in large part because of pollution from the refineries, which were refining the very oil and gas whose combustion was then leading to climate change. So that is really what inspired my journey into all of this, and how I got to be in front of you all today. So, what does climate change have to do with human health? I think, in a word, everything. There's many, many different focus on perinatal health. We're going to talk specifically about two of the major pathways through which climate change impacts the health of pregnant people and newborns, and that is extreme heat and wildfire smoke. So across the globe, including right here in my own community in California, and probably for all of you as well, heat waves are becoming more intense and more frequent. The impact of these heat waves is unequal due to factors like the amount of asphalt cover in a specific city or census tract, tree cover, etc., and almost always related to the ongoing effects of practices like redlining. People living, working, or going to school in adjacent census tracts may experience temperatures that are up to 7 degrees different on the same day and within the same hour. Just like we're seeing with heat, we are also seeing the frequency of wildfire and wildfire smoke exposure increasing as a result of climate change as well. Where I live, as I mentioned, in Northern California, we have wildfire and wildfire smoke season now, and nearly a yearly exposure, and sometimes much worse than that, depending on your location. I think a common and very reasonable question is, well, what is so bad about wildfire smoke? And the answer to that is complicated, and also that researchers are really only at the outset of identifying why specifically wildfire smoke is so dangerous. But we do know from studies that have already been conducted that wildfire smoke is about 10 times as toxic to human health as other forms of air pollution. I think the easiest way to think about why that might be is to think about what's actually burning in a wildfire, especially a wildfire that's intersecting with an urban or suburban area. We think about things that are burning like cars, plastic parts. We've seen, I'm sure, horrific the photos recently out of Los Angeles, that when we think about everything that's being burned in those fires, that we are then inhaling in essentially that material, making it much more toxic even than most other forms of air pollution. So what does this mean for pregnant people and their babies? So we're going to talk first about heat exposure specifically on pregnant people. And just to kind of talk through big picture how heat exposure impacts pregnant people. In the setting of increased heat, we see the following types of things: activation of inflammatory pathways, increased coagulability. We know pregnancy is a hypercoagulable state, or a state of increased coagulability to begin with, and then adding in heat and heat exposure further increases that. We can see alteration of the central nervous system's regulation of the heart. We can see dehydration, which makes a lot of sense, reduced blood flow, and altered blood viscosity and increased blood pressure. So when these pathways are activated for a pregnant person who is exposed to increased heat, we can see things like release of hormones like prostaglandin, oxytocin, heat shock proteins that can lead to preterm labor. And we can also see outcomes like preeclampsia, placentia previa, and accreta. Put differently, during pregnancy, many bodily functions are more susceptible to the impacts of heat. And so we can see a resulting increase in adverse birth outcomes and then long-term consequences to babies and children. Encouragingly, research into the areas of the effects of climate change on pregnancy and birth outcomes is increasingly robust and emergent. It is beyond the scope of this talk to address in depth all areas of this research, but I want to highlight a few of the major findings and papers from the last few years as a way to suggest where people can find more information if any of this sparks particular interest. In 2024, a meta-analysis was published that looked at close to 200 studies across 66 countries and found increased odds of preterm birth per 1 degree Celsius exposure, and then during heat waves generally. Additionally, the odds of any obstetric complication increased by 1.25 during heat waves. The reason for this, the authors conclude, is the anatomical and physiological changes during pregnancy alter thermoregulatory response and therefore make it more likely that pregnant people experiencing increased heat have these adverse outcomes. This is a systematic review published in 2020 that looked at 68 studies and close to 33 million live births in the US and found there to be a statistically significant association between heat, ozone, or fine particulate matter and adverse pregnancy outcomes as well. Notably, this study also found marked racial disparities in outcome as well. One point that I just want to make, I think many of us have experienced this and understand this intuitively, but on days that are hotter, air pollution becomes more potent. So there's often a commingling and a coexistence of these two of factors of air pollution and heat combining to actually become worse when we're experiencing a heat wave. So that is a lot of doom and gloom. I could go on, but I won't. I think you guys probably get the gist that climate change impacts health. It specifically impacts the health of pregnant people and neonates. It's quite a scary thing, I think, to contemplate fully what the future might hold and the reality that we are facing. So for the rest of my talk, I want to focus on what we can actually do. How can we stop further harm from happening? How can we educate our patients and their families? How can we make change together? I think the good news is there is a lot we can do. And I say that even today, knowing the reality that those of us in the US are facing politically, but I still stand by this argument. So first of all, I want to just make sure we all understand and center the fact that health is on our side. So I started off a few minutes ago talking about my experience working with patients in Richmond who are exposed to pollution from the Chevron refinery. So we know that the combustion of fossil fuels, and by fossil fuels, we mean oil and gas, coal, natural or methane gas. We know that that combustion is the primary driver of climate change. But even outside of climate change, fossil fuel pollution is dangerous to health unto itself. Researchers estimate that pollution from fossil fuel combustion is responsible for 20% of premature deaths worldwide. I'm going to say that again, that's 1 in 5 premature deaths worldwide is thought to be related to pollution from fossil fuels. We know that the combustion of fossil fuels is dangerous to our health, especially the health of pregnant people and newborns. So we, from all of this, can clearly lay out that transitioning off of fossil fuels is healthy, big picture and long term, because we know that's what's driving climate change. But we also know that a transition off fossil fuels results in improvements to health in almost an immediate way. So when I think about my patients in Richmond, there would be, and the data shows that there are immediate health benefits to when that pollution is lowered for the communities that are most impacted. I also want to bring up the fact that whether or not people are talking out loud about climate change, the data shows, and certainly my own experience is that people are thinking about it, and in many cases, they're worried about it. And most of us, really, the data shows us around the globe and in the US, are hungry for these conversations. What I'm showing you here is data from Yale and George Mason universities. This is from polling that was done just in December of 2024, showing that 54% of respondents here are identifying as either alarmed or concerned about climate change, with only 22% identifying as doubtful or dismissive. And if you look at where this trend has gone over time, this is showing over the last 10 years how respondents have answered these questions. And this is looking at a sample of over 25,000 American adults polled between 2014 and 2024. And you can see here that the group identifying as alarmed has increased by 11 points during that time. So to continue to link all of this together, so we know that people are concerned about climate change, that people are thinking about it, even if they're not necessarily talking about it. So who cares then if we as medical and health professionals are the ones talking about climate change or are talking about climate change? And actually, it turns out that a lot of people care, whether we're the ones talking about it. This is data from Forbes and other another polling service looking at the most trusted professionals in America, and routinely year after year, nurses, pharmacists, physicians, and often other health professionals rank in the top 3 or 4 of who Americans trust most when they're thinking about professionals. Beyond that, we now have a lot of data to show that physicians and primary care doctors specifically are seen as highly trusted sources of information about global warming. One of the things that I want to point out here is this study actually looked at patients' trust in their primary care doctor around the topic of global warming based on how patients identified politically, whether they identified as more liberal or more conservative. Interestingly, trust in primary care doctors as a source of information was higher among those who identify as either liberal, moderate Republicans, or highest in conservative Republicans. So interesting data when we're thinking about who are the, who can we be talking about this with? Will people be sort of put off by medical or health professionals talking about these topics? And I think the answer, surprisingly, is a no. So we're going to try to pull a bunch of things together now. So we know climate change impacts human health. We know it especially impacts the health of pregnant people and newborns. We know that the public is interested in and concerned about what's going on. So now I think the elephant in the room, the question is, well, what can we actually do about it? And the answer to that, I think, is also a lot. And the answer to where can we do things is really everywhere. So our voices as trusted health professionals matter a great deal. It's up to us to use them. And I think the level and the places in which we use them are really one of the things that we get to decide. Whether it's we're talking with patients, talking with our friends, our colleagues, our families about the impacts of climate change on health, whether it's within our hospitals or medical systems, within our professional societies, in our communities, in our schools, in our communities, with elected officials, either at a local level, a state level, potentially at a federal level, and an international level. So I want to start really focusing at the individual level and talking about patient counseling, because I think this is something that for all of us comes up if we're directly interacting with patients, if we're discharging families, that comes up a lot and will continue to come up more frequently as the effects of climate change become more and more visible. So speaking specifically about how to talk to our patients and their families. We can think about things like whether our patients and their families have a plan of what they will do in the event of a heat wave or in the event of decreased air quality. Especially, I have a colleague who has a harrowing story of discharging babies from the nursery into a heat wave in a community that did not have high penetration of air conditioning. So making sure that do families understand where a lot of communities increasingly have cooling centers. They may or may not be the perfect solution, but they exist. Do families understand how to find a cooling center in their community? Could they go there if that was necessary? Do families understand how to interpret air quality information? I think for thinking back to that period of time for myself, kind of 2017, 2018, I had never really thought much about looking at an air quality map prior to that. And now I understand how to interpret one and what the different numbers mean. That's something that I can help families and patients to also understand. So a lot of this is about familiarizing ourselves with what the resources are, either in our communities, available online, et cetera, and then making sure that we're able to convey that information and answer questions from families. I just wanted to point this out. I have not personally used this before, but I thought this was interesting to find. This is a standardized heat and health risk factor screening questionnaire put out by the CDC called Chilled Out. I won't read through all of these questions here, but this is something that I think could be very useful for helping to understand what risk factors our families or patients specifically have, and how we can best counsel them in light of what those risk factors may be. The next level that I wanted, so that was really one example of talking to patients and families. There's many, many more. I hope we'll have time during the discussion portion. I would love to hear what other folks are doing around this. I wanted to just show an example of what that could look like. The next kind of level that I want to talk about is what's going on within our health systems and the healthcare sector itself. So this may be a surprise, it may not be. I was certainly surprised when I first learned that 8 to 10% of total US greenhouse gas emissions, greenhouse gases being what are CO2 and other gases that are what's causing climate change, are coming from the US healthcare sector itself. So if all of our hospitals and clinics were a country in the US, we would be the 13th largest emitter on the planet. So we have a lot of work to do to clean up our own workplaces and to make the way that we practice medicine and deliver healthcare more sustainable. So this can look like lots of different things. I'm happy to refer people to resources if that's helpful. There's a lot of amazing organizations doing this work, and educating providers and administrators and so on and so forth about how to make these changes. So these could look like things like changing the formulary of anesthetic gases in our operating rooms so that the gases that we're using aren't as bad don't have as high a global warming potential as the ones that we historically have relied upon. It could look like changing the menus in our hospital cafeterias or the foods that our patients are delivered when they're admitted to the hospital to be more plant forward, potentially to include less plastic waste, et cetera. There's lots of examples of work being done here. I would encourage people who are interested to look at Healthcare Without Harm. The National Academy of Medicine is doing a lot also around healthcare sustainability, and this work is really vital so that we ourselves can decrease the environmental footprint that our own services are causing. Thinking outside of our hospitals and clinics, but within the medical societies and health organizations that many of us are members of. So I'm a pediatrician. I use American Academy of Pediatrics as my prime example, although that is just but one. So to use American Academy of Pediatrics as an example specifically, we have a statewide organization that represents pediatricians in California that does legislative lobbying. Historically, that lobbying has been in the name of child health, but it hasn't had much to do with climate policy. And one of the things that I'm particularly proud of is are really helping to influence the types of legislation that our American Academy of Pediatrics California understands to be related to child health and the types of legislation that they're putting their lobbying resources behind. And this year, actually, for the first time, they will devote actually lobbying efforts to a climate bill that's that the legislature is hearing in California. I'll talk a bit more about that at the end. But this is just one example. There are many. These organizations are member driven. They want to hear from us. And if enough folks who are members get together and say, we want to focus more on climate health related policies, we want to have more attention put there, they will ultimately listen to us. So last but certainly not least, our health voices matter outside of our hospitals and clinics, and they matter in our communities. So people, as we've talked about, people are hungry for understanding what is going on and what they can do to keep their family safe, to keep their kids safe, and what they can do in many cases to help mitigate or stop what is happening. And again, this is where our voices are so important and can play such a powerful role. This is not exhaustive in any way. I just wanted to present a few ideas or places that interested people might look for places in their community where they could get involved and talk from a health perspective about what's going on. In California, we have what are called air management districts that often consist of many counties together where decisions are made about how things like air pollution and sources of pollution will be regulated. And that is a place where there's often a lot of industry opposition to regulating pollution, and a place where speaking as a trusted health professional about the impacts of the air pollution on your patients, on health generally, can go a long way in terms of shaping the policy conversation. There's opportunities in our communities across the board with utility companies, opportunities to talk about what's going on at ports and refineries. Many cities are changing their building codes as we move more toward electrification. And again, our voices are vital in terms of amplifying why these things are important. In our schools, again, I'm a pediatrician, so I think I naturally go toward where the kids are, but I think that there is a really powerful opportunity for health professionals and the health community to work with schools, with students, to help them understand what's going on and what we can do. Things like advocating for electric school buses, the Inflation Reduction Act, which was passed 2 years ago now, which is the largest investment in clean energy that the US has ever made, and has a lot of potential benefits to our schools, and is now unfortunately at risk. But there's a lot of potential for us to speak up and about why these things matter and why they matter for health. I wanted to specifically call out a series of bills when I mentioned American Academy of Pediatrics California. This was actually the bill in California that they are supporting, but across the country, we're seeing legislation right now that falls under the bucket of polluter accountability. And interestingly, this concept of polluter accountability, which is essentially that those who caused the damage should be accountable for paying for it, polls extremely well, really across the political spectrum. So from conservative Republicans to liberal Democrats, there's wide consensus that when people hear about this concept of polluter accountability, they support it, that yes, that makes sense, that if you caused this problem, you should be accountable for it. 2 states, Vermont and New York, have actually already passed into law climate super funds that require historical emitters to pay into a fund that can be used to help cover the cost of damage that's already been done and actually help with mitigation. In my state, California, we have legislation that's being heard this year that would establish a similar fund. And there's many other states that are considering this. Connecticut, Massachusetts, New Jersey, Oregon, Maryland, and Rhode Island are the ones that I'm aware of, and there may be more beyond that. So I'm going to wind this down shortly and open it up to conversation. But I think the message that I want to impart above all is that for those of you who are concerned about climate change, who are wondering what you can do, I think our health voices are our climate superpower. That's what I really believe, have to offer to this moment and in this moment. And we need to use them. We need to figure out how and where we want to use them. I really love this diagram. This is from Dr. Ayanna Elizabeth Johnson, who's a marine biologist and a writer, and she created this quite simple but I think very powerful Venn diagram to try to help people understand and figure out where they want to kind of jump in terms of action. So she encourages us to look at the intersection of three things. What are you good at doing? What skills do you have? What is the work that needs to be doing, and what brings you joy? What is something that you could reasonably do for a stretch of time and be happy doing it? Because this work, as we are probably all too aware, is not short-term work. It's a long fight ahead of us, and one that has already had many fights in the past. So I would encourage you guys to take a look. I have the website there at the bottom. I think just as a nice way to try to understand where you might fit in. These are just some of those studies that I talked about. And that is it. Christina, should I try going back on video?
Let's try that. I was
Okay.
just about to say, why don't you come on
Yeah.
camera?
Okay. Okay.
Hopefully,
We'll see. I
hopefully
don't
we'll keep
know.
you there. It's all
Yeah.
right.
Okay. Okay.
Yeah, yeah.
Okay.
And let's have you leave that up for a second.
Sure.
And then we'll have you come off there, and that way we have a full screen of you.
Okay.
And that'll be nice. So thank you. Number one, thank you. Can you update us on pediatric asthma rates?
Oh gosh, not off the top of my head. I can tell
Okay.
you where to get that data.
Okay.
It really depends. I mean, it really depends on where you're looking.
Yeah.
But
Okay.
the data, and there's probably people who are following what's going on federally and in the news, hearing about a lot of the EPA rollbacks and regulatory rollbacks that are
Yes.
happening. I think the that I don't want to pretend to be able to
No.
just give data that I don't have at my fingertips, but certainly if we look at regulations like the Clean Air Act, like the Good Neighbor Rule, which was an EPA ruling just a few years ago, so on and so forth, these regulations have saved hundreds of thousands of lives, and especially the lives of children, impacted the lives of children. So I'm happy to follow up with more specifics, but I think big picture, as we have regulated pollution, we have seen immediate and long-term health benefits, especially the kids.
I I wanted to be further educated about environmental justice. And I grew up, I'm a native San Franciscan, as I told you. And, throughout my life, have heard about when the refineries go astray over in the East Bay, especially in Richmond. And I read The Sum of Us. And
Okay.
it just helped me to understand environmental justice and the history of Richmond, California.
Yeah.
I would highly recommend that. The story she tells is quite compelling. Okay, question. There's a lot of unnecessary waste in our perinatal practice. Equipment opened a lot, unused. How can we, is there collaboration? Is there something we can do together to decrease this waste?
Yes. Yeah, that I wish there was an easy answer, just do this one thing. I think the answer is that it is going to be more complicated always than you want. And increasingly there are success stories of people decreasing waste exactly in that way. So I'm thinking specifically of I have a colleague who changed the way that she's an emergency department doctor, the way that they stock their laceration repair trays. They cut out, I think, something like 70% of what was in the tray, because exactly, for probably similarly, most of what every time you open a kit, it all gets thrown out regardless of whether it's
Right.
used or not. My advice, I couldn't say specifically here's how you do it, but my advice would be, depending on where you work, to look to, is there a sustainability officer? Is there a green team, a group of interested employees who are trying to make changes like this? I think getting together with other people makes a world of difference, rather than trying to kind of go it alone, even if it's just finding one other person who wants to make this change with you. And in terms of healthcare sustainability specifically, we have the benefit of the finances are almost always on our side. So with waste reduction, almost always comes cost savings relatively immediately. So especially in the kind of environment and climate we're in right now, as a healthcare system, being able to point out those savings is often a very large motivating factor for
Right.
administrators who need to make changes.
Right. Now I'll have you stop your screen. People saw your
Oh,
email,
okay.
and hopefully folks will be able to see. Okay. Are there any studies that you're aware of that look at placentas or cord blood in pregnancy exposed to wildfires?
Oh, that's a great question. Not that I know of off the top of my head. So there is a researcher down in San Diego named Dr. Bruce Becker, Bekkar, who does research around birth outcomes and wildfire smoke exposure. I don't know if that specific question has been examined yet. But I would start by putting his name into like a Google Scholar or PubMed search and see. And I can also follow up. He's the author, actually, I think, of one or two of the studies I talked about. He's who comes to mind first and foremost. But I think that is a great question, and I think if it isn't being studied, it probably will be soon.
Got it. Got it. There's a thank you in there. There's a call out for, oops, I lost my Q&A. Let me go back. There was a shout out about, let me see, what was that? Oh, I lost it. About recycling plastics. A lot of work going on in that, right? And plastics in the oceans.
Yep. And things that we were told forever were recyclable, not
Yes.
actually recyclable. Yes.
Yes.
Yep.
Yes.
Yep.
Yes.
Absolutely.
So organizations out there
Yep.
doing that.
Yep.
Globally, climate change affects low resource communities who are not able to advocate for themselves. What else can we do since we have more resources than many others?
That's a great question. I think a big
simple
question,
one to
right?
answer.
And easy, right? I think it depends. A lot of it depends on where you want to be working. I don't have experience working internationally that in this realm that I really can speak to. I think what I can speak to is my experience, for example, being a medical provider in a community like Richmond, or in Richmond, in my example, and which is um, under-resourced and marginalized in many ways. And there is, so I can speak to that and sort of some of the lessons I've learned in terms of engaging in the community, and some of the sort of pitfalls and sort of best practices. I think the largest piece of advice I would offer is to enter any space with humility and with acknowledgement of the fact that, even, yes, I may have, a medical doctorate, be a physician and have this role, but I don't understand everything that is going on in this community or that has gone on in this community, and really entering with an attitude of how can I help, and where could my voice be useful. Obviously, we're not, I'm never wanting, to uplift or share something that isn't factual, that isn't scientifically based. But where at the intersection of what the community needs and what I can offer, where can I find that intersection and how can I work there? And showing up, proving to a community that like I'm not just here this one time because it makes me feel good, but I am really actually invested in the outcome of this community and these kids, in my case as a pediatrician. So I think there's really a need for our health voices, and we really have a lot to offer. And we need to understand that we aren't always necessarily trusted. We aren't always necessarily welcomed into spaces with why because of things that have happened in the
Absolutely.
past. And so trying to really understand where things stand before we speak up, and out is, I think, the best advice I could offer. And I haven't worked internationally, but I would have to imagine that is, if anything, only more true in settings outside of the US.
I'm sure, I'm wondering, like, I have a feeling you get questions from families about buying air purifiers for the house.
Yeah.
I mean, what does science is?
Yeah. So that's a great question. And I do get asked that. And I think the things like the what I would bring it back to is having we aren't going to know everything. We're not going to be expert in all of this, but
Right.
knowing where to go for resources, I think is a huge piece of this. So for example, like some basic things that I think are the kinds of things that we can just commit to memory right now. MERV 13 filters are the highest quality air filtration system that you can have. So that can be helpful to be able to share with families, especially if they're wondering if what they have at home is adequate or not. There are two other sort of examples of what types of resources I think are helpful for us to have at our fingertips. Again, where I live in the Bay Area, our air quality management district has, I don't know if they'll offer it again this year, but the last few years they have offered basically free in-home air purifiers for families who are in need. And so being able to refer families to get an air filter has been really valuable, just knowing as a provider that exists and helping families to connect with that as a service. During some of the more intense moments, at least in the Bay Area with wildfire smoke exposure, some of us probably remember it was very hard to buy air purifiers
Yes, it
during
was
some of these
masks.
times. Right, exactly. So knowing where I took this slide out actually, but I can share it out after if that's helpful. The can't remember, it was an organization in the Puget Sound, maybe it was their health department, had this really great, I think they still have it on their website, basic overview of how to actually make an air purifier, like a DIY air purifier. If you're not able to buy one, that I shared with families when we were really in moments of people reasonably
Crisis.
saying like, there's nothing to buy. I have a child with asthma at home. I have a baby at
Right.
home. What can I do? And I can think of one family in particular where we actually sat down and like walked through the steps that they were outlining, and figured out how they might be able to make this.
Yeah. Yeah. Thank you. Thank you for
Yeah.
doing that as a
Yeah.
clinician too. I mean,
It's a brave new world.
wow. No, it's just wonderful. I'm trying to think if there's any other questions before we sign off here. I think that might be it.
Well, thank you all for having me. Thank you, Christina, for your help. Sorry for the tech
Oh,
problems.
no,
Yeah.
no. You've done such a lovely job. You've been so wonderful to work with, and we're so grateful to you. So
Thank
thank
you.
you, Dr. Milstein. We really
Thank you.
appreciate it.